I'm Trish Power Scott.
And I'm Lynn Loria.
Welcome to Two Cents of Sunshine.
And Sam.
Yeah. What do you guys think?
I
think
love-
it's brilliant. But there's peptides for everything, and I'm obsessed with them. If you have not yet, I would love for you to read the book, The Complete Guide to Peptides. It's a great book to read, just to understand them completely, what they're consisted of and what they do. But we have a specialist with us today, so we don't need to read anything. We're just going to ask Sam all of our questions. So,
Absolutely not. No. I think people should be educated about what they're putting in their body.
Yeah.
Just in simple terms, able to understand
Yes.
indications, recommended dosing ranges, why not to use that particular peptide, because there's also peptides you don't want to use.
Okay, interesting. Yeah.
So it's a good place to start.
Okay, great. So I'm going to give you an example of why I started getting addicted to peptides. I have a hip injury that is like 10 years old. It happened during childbirth of my second son. I have had every medical thing try to get that you can have. I've had CTs, MRIs, bone scans, x-rays. I've had everything, PT, chiropractors. I've done it all. And I have this hip pain that won't go away. We put me on, what did I take for that? BPC 157. I'm not joking, within 2 days, my hip pain was 95% gone.
Wow.
It was to the point that I wasn't sleeping at night because the pain would radiate from my hip down to my ankle, and sometimes go up to my lower back. I'd get off of it at night that the pain would kind of just radiate, and nobody could do anything for me. So we kind of talked about systematic inflammation. And at this point, I just don't care. I'm like, do something, make it better. I need to run again. 2 days, I'm not remotely being facetious or exaggerating. 2 days on 2 shots of BPC 157, and my pain was 95% gone, and I slept through the night. So
We could actually probably pull the date stamps from those text messages.
we probably could.
Evidence
Now, okay, I was like, this can't be. Like,
That's
I'm
crazy.
not walking. I'd get out of my car and have to shimmy to the other side because I couldn't put weight down. And it was bad. I mean, I probably deserved a handicap sticker. I'm not even joking. I would like hobbling along in life. And for a person like myself, you guys know I like to work out. It was horrible.
And that had to be a lot of years. Was that your youngest? So
My middle. So he'll be 10 in February. So when they took him out, he got stuck literally, and they tore my hip out of its socket to get him out. So when they put it back in, I'm not sure if it didn't go in right or if it's just the pulling of him out or whatever. All I know is my kneecap was at my ear, and that is not a normal space. Right? Where you're supposed to be.
I'm going to go with
no, there was a doctor here saying a bunch of stuff and a doctor there saying a bunch of stuff, and they thought they broke his clavicle. I mean, his shoulders were wider than my pelvic bone. So they literally had to get him out. So thank God he's fine and everything's fine. Well, I've had an existing hip injury. 2 days. I just can't, even. It was like mind blowing.
So that's inflammation, you're saying. Well, when you talk about inflammation. Yeah. So what she is referring to, it's commonly called the Wolverine blend, and it's a combination of BPC 157 and TB 500. And so those are peptides that will reduce inflammation, particularly used if it's the injectable towards soft tissue inflammation. So it's helping with muscle recovery, tendons, can even help with ligaments. There's also oral BPC, which is phenomenal for healing the gut. It addresses tight junctions. It is an excellent adjunct to my patients with IBD. It can help heal the gut biome. It's amazing. Now, Wolverine, the BPC 110 and TB 500, is more of an older generation, and that medication now comes in different blends. So it can be combined with GHKCU, which is also an excellent peptide for a number of reasons. And there's even a newer one that's called CLO, which combines BPC with GHKCU and also KPV. And KPV is such a powerful anti-inflammatory. So that would probably be the most comprehensive blend right now that I am offering to my sports injuries.
So
it's amazing.
Yeah. And when I initially started, I actually started on just BPC 157. So I had that with the GHKCU for my hair. You guys hear me complain about my hair all the time too. That was a baby thing as well. My hair is not great. It's getting so much better. I'm growing extra hair, but GHKCU can be spicy. Ooh,
yeah, so
it leaves the birds. Birds all day.
Yeah,
it's like someone like punching it in the gut. No, it's an injection.
Okay, it's an injection. Yeah. Now, GHKCU in studies has actually been proven to be more effective than minoxidil or finasteride at hair regrowth. So it can come topically or it can come as an injectable. The injectable is a little spicy, so you have some 10, 15, 20 minutes of burning afterwards at site irritation. But when it's in a blend, and if you dilute it with the reconstitution, that can certainly help, or applying an ice pack after injection.
So I will tell you, none of those things worked for me. Whether it wasn't 10 minutes, 20 minutes, it's an entire day. It's an 8-hour day
Wow.
of burning. And no matter how much I dilute it with bacteriostatic water, it doesn't matter. Bacteriostatic water is how you reconstitute your peptides. So you can add more to it and then it would make it more diluted. It did not work. However, once I put it into, so once this was working and I realized this was something I wanted to do for a long time, we talked about blends and we started with the Glow Blend until Clo came out and I added the Clo. I do not get the burning at all. So it's just diluted enough within itself that it doesn't burn anymore. Now, I just don't want you to think that if you're burning all day like I was, something's wrong. It's not. Everybody's different.
Right. So if not everybody has that same particular reaction that you did, but it is something to be aware of and to offer different alternatives, because not every peptide is for every patient.
Right. And I also find too, when I was injecting it, if I didn't have like a really fatty part to grab onto, it would hurt worse. So if I was injecting him in my abdomen to start and I actually moved to the fattiest part of my butt, and it's way better. Like that, I think that might be a huge part of it too, is you really need like a chunk of fat to grab, because if you're just injecting it for me and not a fatty area, it would burn like the dickens, like just bad.
I think it's important to note also that you're doing a subcutaneous injection, not an IM injection. So if she's not going into the muscle, we're going into the fat layer.
Yes. Yeah. Oh, okay.
So it is better to then go into more of a fattier.
Yeah. So you're just going into, I use a 45-degree injection, and you're going either into the part on your abdomen. Some people can do lateral thighs or posterior arms. You particularly don't like those locations, but I do my shots in the abdomen.
Okay, but I didn't realize you're supposed to put it on an angle. So you put it on an angle, a 45-degree angle when you put it in?
The needles that you're injecting are so tiny. Typically, it's an insulin needle, which is a 30 gauge.
Yeah, mine's
If
teeny,
it's
teeny,
5/16, you could go in at a perpendicular injection, and you're not going to hurt anything.
It's not going to hurt anything. I've also had a question about the bubbles in the needle. So you know when you pull the liquid back, whatever you're pulling back in the syringe, they get bubbles. Is that bad if they're shooting the bubbles then in?
I prefer you don't inject bubbles.
Okay. They're hard to get out.
No bubbles.
No bubbles. I've had a lot of people.
Bubbles are bad. Unless you're in
I
Prosecco.
think that you're going to get an air emboli from a small bubble in a needle going into a subcutaneous injection. No. Do I think that teaching patients a proper injection technique is important? Absolutely.
Okay. So how do we get the bubbles out?
So a number of ways. You don't want to shake your peptides. You roll them between your hands. If you are injecting, you're going to have your vial inverted and you're drawing back on the syringe. If I'm injecting a peptide, in 10 units, say, I will draw back to 2T, make sure my syringe is totally filled, and then push the rest up until I hit that 10.
Okay, so
you're pushing
over, pull out, and then
over
push it
drawing.
out. Sometimes there are some stuck in there too.
You can,
I've noticed if I flick it, it'll go to the top.
Yeah.
Or if I just change the angle of it, it'll sometimes just stroll to the top.
and you can also prime the needle. So if you just push the syringe up where you see that small little drop at the top of the needle, that makes
okay.
there won't be any air.
Then there won't be any air in there. Okay. Yeah, we've had a lot of people ask that question about the air bubbles, and I wasn't sure. And I was like, I don't know, I do it, so I guess it's fine. But then I was thinking, wait, could you maybe blow your veins up? Is that a thing? I don't know.
Well, you're not going into a vessel.
Yeah,
so
right.
you're going
Okay.
into the fat.
Yeah,
But
just not great.
we will do proper technique.
Okay. Yeah. We'll do a whole podcast about, or like just a little video.
Constitution.
Yeah.
Bring some needles in.
Okay.
Fake ones, of course.
Yeah.
And we'll do
I've got a bunch of real needles.
Someone asked me recently, could you just like show me you injecting yourself? I was like, sure, I don't care. Like, I'll show you mine.
Look at theirs.
Yeah.
So the VA actually has an excellent guide on injecting.
Okay,
And,
great.
Yeah, there's a lot of resources out there for patients that are reputable and screened that they can use for sure.
Because here's the thing, you are going to have to get used to injecting yourself. I mean, that's just, for me, it was definitely a thing for me, but I'm used to it now. I don't even, not phased about it anymore. So the things like GHKCU and BPC 157, you can take them 5 days, 7 days a week. So you are injecting daily, with those things. So it's something you're going to have to be comfortable with. I did not realize there was a BPC that's oral.
BPC, oral BPC is actually used as a great adjunct with GLP medications because it can also help minimize bowel wall edema or GI side effects.
Oh, interesting.
So for some particular patients, I do recommend that they piggyback with both.
Yeah. And that's another great point with peptides. You really want to make sure you're stacking the right ones because they can be so much more powerful if you're using all the right ones together.
Sure.
And that's why it's so important to have someone that you go to that you say, okay, these are my problems. These are my issues. What are the best things for me? It's not just a one-stop shop. Like, oh, take this. You have a hip injury, take BPC. It's not just that. Stacking them together and knowing all of the things that are out there, which you couldn't possibly know every peptide. The book, wait till you see the book. It's this thick, and all it is a description of of what's out there.
Wow.
Yeah. I have just been reading about tesamorelin and ipamorelin and CMAX. Tell me about that.
Gosh, I know nothing.
So
That
those are
was the
two,
first time.
those are two different drug classes.
Okay.
So the ipamorelin and samorelin fall within the growth hormone secretagogues.
Right.
I like to use them in men if you're alternating with an IGF, if you're looking to build muscle mass. I do not love the growth hormone secretagogues in females because the growth hormones can go down the IGF-1 pathway, which can down that line trigger breakthrough bleeding in females.
Really?
Mhm.
And
So-
nobody needs more of that at the 40
Yeah.
age range.
No, so it's it can be used, but that would just be one thing that you need to monitor closely. Also, growth hormone secretagogues should not be used in patients with history of cancer because it can feed that. So that's not one that I typically use in my female patients or history of
Interesting.
cancer.
See, I'm so glad to have this conversation today because I've been seriously considering if you grow more muscle, you burn more fat all day long. Your muscles are little fat burning factories. So the more muscle you have, the more fat you burn, the more you can eat. Right?
So for that, I would recommend more of like a SLU PP332.
Oh, I'm obsessed with it.
Yeah.
Yeah.
So SLU. Lynn, we have so much.
I know. I don't know my numbers. I got a lot of
Yeah.
numbers here.
So
I'm obsessed with SLUPP332. I feel like it has completely changed the composition of my body.
yeah.
Yeah.
Sure.
And that's an oral. That's just a pill.
Oh.
And
It's a mitochondrial peptide.
Okay.
So mitochondria is the powerhouse of the cell, as we all know from biology class. And that was actually the first peptide I tried was one called MOTS-C. And
is
MOTS-C.
that the one you thought you were having a heart attack?
No, that's NAD.
Oh, yeah. Okay. Yeah.
Do you want to talk about that?
Trial and error with peptides. I'm just raw dogging life over here. MOTS-C, the published research actually goes back to the 1980s. And
Okay.
it is a fantastic peptide to reset the mitochondria, particularly in postmenopausal females. It helps to improve efficiency, create more ATP. And for me, after I finished chemotherapy, the best way that I could explain it is that my mitochondria went into a battleship state. So my body was under so much stress that instead of making 36 packets of energy for every Krebs cycle it was making 2. And that's why I couldn't get off the couch. I couldn't stay awake all day.
Right.
The MOTS-C really works to address that. And it resets it. So that's what gave me the power to go to the gym. That's what gave me the power to stop napping every day. Now, you have MOTS-C, which is mitochondrial peptide, but then you also have SLU-NAD+, you have SS31. All of those work within the mitochondria. It's just at which step of the Krebs cycle are you going to?
So would you take MOTS-C with SLUPP332? Or
MOTS-C isn't a peptide that you have to take consistently. Certainly,
you
there's
could, like,
different
on your
doses.
down days, like, so.
It's once every 6 months I would do it.
Oh.
So I do
Oh,
it twice a year.
And
It's
that's
5
it.
injections.
5 injections in one day?
No, 5 injections every 4 days. It's a 20-day regimen, and I
Okay.
do it once every 6 months.
And then you feel like that gives you the energy for that 6-month period?
It
Or do you start to deplete
changed
toward the
my
end?
life. It changed my life. Now, granted, I'm on other peptides, so I take SLU PP332 every single day.
Are you obsessed with it too?
Absolutely.
Yeah, I'm obsessed with it. I can't stop.
I have to learn.
I don't have to pry it out of my cold, dead hand.
That's
I don't
what
know how much
that-
it costs.
I take methylene blue daily.
Yes, methylene blue. I joke. We call it blue meth. I'm on.
No, mad.
If the FBI is watching my text messages for my friends and patients who are trusting me for more meth, that is concerning. But methylene blue, also, you have to watch out. You can't be on an SSRI or other medications that increase your level of serotonin. So you really have to watch out for serotonin.
Interesting. Why is that?
Just the way it works.
The way they
in the brain.
chemically balance together. So SSRI is anti-anxiety, antidepressants. Correct. Okay. So those types of
Selective
things.
serotonin reuptake inhibitor. So
Got it.
increasing the amount of serotonin in your brain.
And then the blue meth cannot be mixed with.
Methylene blue.
I'm sorry, methylene blue.
Yeah.
That's what I call it. Blue meth.
We're going to get a lot of
We're gonna
So you want to look for what is
Yeah.
the patient's med list, making sure there isn't any drug interactions, monitoring them for symptoms, which would be an emergency. Just knowing what
what would happen on those two things if someone took them together?
It's rare, but it's serious. So serotonin syndrome, you would be looking for mental status changes. You would be looking for agitation, anxiety, irritability. You would be looking for sympathetic or autonomic hyperactivity. So fever, sweating, higher blood pressure, increased pulse rate.
Like anxiety.
Yeah, but then
Crazy.
you also have muscular changes too. So if you have neuromuscular hyperactivity, so you would have twitches, ankle flexes, tremors, shivers.
Okay, good.
That combination, especially if you're demonstrating increased muscular activity, rigidity would be another one. That is an emergent situation.
Oh, interesting. Good to know. See, there's all these little things, and this is why it's so important to have a provider and not just go on the internet.
Absolutely. I
Right.
fear hearing all this, that people are going to, that are not hearing this.
Amazing. And it's very rare that it would occur,
Right.
but definitely having that oversight.
And having someone watching what you're
Absolutely.
doing, right, and monitoring,
Yeah.
whether it's something as simple as a GLP and how much weight you're losing, to something as serious as this, right? Like it's just really, really important. And I know the questions are going to be, okay, so where do we get it? We'll get there.
And what's good for me? What do I need?
Yeah.
Like, what is it? I'm hearing all these numbers and I'm like, I don't know what number I am, but I know I need a number or two.
Yeah, what are your goals?
Right.
Mine was for health optimization, increase energy, and then also prevent cancer from ever coming back.
Yeah.
So my favorite peptides were the MOTS-C. I'm taking SLU. I'm doing the methylene blue, which technically isn't a peptide. I do thymosin alpha 1, which works on the thymus gland. That helps my immunity. So I do that. I did a course of epitalon, which helps to protect the telomeres on the ends of my chromosomes. I'm trying to think, GHKCU also protects against cancer, but it also helps with skin, hair, nails. It's the youth in a vial, if you will.
Can you do both? Can you do the topical and the injection? You better say yes, because I am doing that.
The Ordinary has a fantastic peptide serum, and it has the copper in it, so it comes out blue. And I use that on my face, which is amazing.
So I do use Scantafix, that website. They have topical GHKCU and Snap 8, which is like Botox in a bottle. You have to have. It's like amazing. And I put the GHKCU on my hair and my face. But the difference of my skin is incredible. Like it's noticeable. It's crazy. Like all the I'm getting there, right? At my age, I'm getting up. All the fine lines are just I'm telling you. They're gone. It, like the smoothness, the texture. There's huge difference.
You can tell.
You can see it. Yeah. It's wild. I was really getting a little crusty looking there for a minute.
Salty, crusty, spicy. I love her.
You can also do topical estrogen, which will increase your collagen and elastin fiber.
Where do you put that? Right on your face?
Yeah, put it on your face, on the back of your hands.
Oh.
On the back of your hands. Yeah, a lot of aging just because of the chronic UV sun exposure when we're driving.
Yeah. Do you ever notice like
mine's
they
horrible.
have like tons of dark spots on?
Yes.
Yeah.
Like that.
So you can use
Okay.
regular, like estrogen. It's kind of different than the
one that I use is a compounded. So it has the GHKCU and the estradiol in a face cream. I keep it in my fridge, and then I just put a little dab will do ya.
That is a really good point too. Most peptides have to be refrigerated. So make sure you're paying attention. They will lose their efficacy if you don't keep them in the fridge.
So, and I have a question. So I'm hearing all of these different things, and I feel like everyone's like, okay, I want that. I want this. I want this. I want this.
Same.
And every husband's out there probably, if they're like watching their wife now, they're like, how much shutting this off? Because this is going to cost like thousands and thousands of dollars a month.
Yeah.
All right. So how does someone, fit some of this into a budget? Or is it just where you try to just do the
I think it just comes down to a very serious discussion about priorities. And believe me, I have been at a point where we can't afford all the peptides that I want to be on, But for myself, my husband and I sat down and I said, this is what I need to do to preserve my health. And I was in a situation where my health was taken from me in a split second with a phone call. And so now it is the top priority for our family. And my husband and I are in agreement with that. So that comes with the expense of my gym membership. And this is the first time that I've been consistent with my exercise routine. Before, it used to be part of self-care. Absolutely not. Laundry will not get done. My house will not get cleaned. My children may have a little bit more iPad time because I'm going to the gym.
Same.
And I'm not compromising on that. And so that's one. The peptides that I am on is to preserve my health and prevent. So I sat on a congressional board reviewing ovarian cancer research last year. And it made me very aware that I need to do everything I can to prevent a reoccurrence because ovarian cancer is a cold cancer. So immunotherapy is not an option. You have surgical resection, which I've already gave all my organs away, or you have platinum-based chemotherapy if you're going with the NCCN guidelines. So everything in my home is geared towards preventing a reoccurrence.
Yeah.
And so
That makes sense.
do we go out to eat all the time? No, it just comes
Right.
choices.
There's no amount that
Yeah.
is not worth
And
it. So,
you don't have to start with $1,000.
right. There's something for everyone's
Yeah.
budget.
Yeah. And I also
much
think
is
you
what
pick out your priorities. So like
Yeah.
for me, it was my hip, right?
Yeah.
Like I don't care what you have to do, fix my hip. Like
Yeah.
that was my one priority.
But once your hip was fixed,
Yeah. Then I
you're
was
like, I'm
okay,
never stopping.
never,
this.
never. I'm done.
And so once you
can't.
have that buy-in that you
Yeah.
see
Yeah.
how it changes the quality of your life,
Right.
it makes it a lot easier to make those choices. Like,
Mhm.
do I need that pair of shoes or do I want my PC?
Well, and the other thing for me,
Well, shoes
Both.
and
Yeah.
we do
the other
shoes.
thing for me is that I am so much more productive and I facilitate my life is very high level, right?
Mhm.
I am up at the crack of dawn every day. I'm raising 3 kids. I'm running a business. I'm doing a podcast with
Yes.
you. I do not skip the gym.
Right.
It's priority.
Yeah.
My laundry will sit there for a week before I'd skip the gym. But if you're running at that high of a level, you have to take care of yourself.
Yeah.
So for me, if I take care of myself and I keep my body at this high level,
Mhm.
do you know how much more money I can make?
Mhm.
So like for
More
me,
productive.
I'm more productive. I can go out. For those of you who don't know, I also own a real estate company. So I can go out and sell
Yes.
how many more
Powerhouse.
houses? I'm
Yeah.
powerhouse. Real estate, yes. But I can go and have, because I'm not tired. I don't need to go home because that's a long day, right?
Yeah.
Like every day.
Yeah.
And I can be that much more productive. I'm so mentally sharp because of I forgot what the
Methylene blue.
methylene blue, my blue meth.
Mhm.
I call it blue
Yes.
meth. I don't even know what it's called. Because of methylene blue, I'm so much sharper that I can, you guys watched it today. How many phone calls did I take quickly? Answer to attorneys, answer to people, and have things strolling along in the midst of things. When you're not focused, I mean, I went through many years of fog.
Yeah.
And when you're not, and especially these menopausal years where you're so tired, you can't function at a high level like that.
Yeah.
So it's helping me to earn more money, essentially.
Yeah.
And if you think that I just made an excuse for myself, maybe I did. And you know what? You're going to go with me. It's fine. I just made myself feel a lot better.
My biggest thing is exhaustion. I will go. And I'm 4:30 a.m. Don't anyone text me then, but 4:30.
Girl,
I'm up.
That's early.
up.
I will send you the
Okay.
PubMed studies about MOTS. It
But-
will blow your mind.
Well, 4 p.m. Like,
Yeah.
we all know I go to Orange Theory at my 4:30 class. So I'm finishing up with a client. I'm in working out. And then I am like, first of all, dragging there,
Mhm.
but I get through and I'm super proud of myself and I know I need it.
Yeah.
And I get home and I literally can lay down for a minute and fall into a deep sleep.
Yeah.
So that's after the workout
After the workout, I'm
I
so
thought-
tired.
thing, because workouts are supposed to make you feel
Yeah.
more energetic.
So I don't know if it's just emotional,
The afternoon slump.
Afternoon slump,
and
yeah.
or emotional heaviness, just with
Mhm.
life and in my profession. If that's happening, and it's just, is that going to work on that? If it's an exhaustion, not from maybe a physical aspect, but more like an emotionally drained.
Mental.
Does
Yeah.
that make sense? Like,
Are you talking to me as a friend or you want medical advice? I can listen and not judge.
to be honest,
Let's go medical advice.
I would be curious to see how you would respond to MOTS. I don't know if you have a med list, but SLU
Mhm.
I think would be beneficial
Mhm.
if methylene blue would have a role. And are you supplementing with testosterone? That
Mhm.
you are. Okay.
Yeah.
And have you had current levels drawn? So those would be
and I just went to the
questions.
GYN. She didn't draw me.
Who's prescribing your testosterone? You don't have
GYN.
really.
Yeah.
Wow, that's impressive.
Look at us moving forward in life.
Yes.
too.
What are you? This is getting personal.
No,
Yeah.
it's okay. The
Okay.
the gel.
You are
Yes.
excellent. Okay.
Yes. I'm
That's our
happy.
compliment. Girl, you do need.
And
Yeah, she does.
Anyone
You
who
need
needs
peptides.
her name, I will give you her name because she was
That
the
is
first
a
one that listened to me,
fantastic
heard me. And when people I know have a problem with someone, I am sending them
Yeah.
directly to her.
It's
They kill me because she's
game-changing.
got so many, because it is game changing. And I think we talked about it last series. I started off with estrogen. That only got me so far. Added the progesterone. That added a different level. And then it was the testosterone that
Mhm.
made, especially starting to work out, you know, even the muscle definition. I'm like,
Yep.
I'm ish. No, I'm not gonna say that. But I've never, my entire bone structure and muscle
Yep.
structure is different.
Mhm.
I think you're going
It's-
to love that. So the SLUPP.
It's an exercise mimetic.
Yeah,
as well.
yeah. Yeah. That was
5, 4, 6, 7.
the same kind of feeling as testosterone.
Yeah.
Because testosterone's game changing. We
Game
absolutely do it.
changer.
Plus, I feel like it makes your marriage really good. We're gonna
Yeah.
have a whole
We're doing a show on
episode about
that.
this.
Marriage, menopause.
Feel what it's like to think like a man for a little bit. So I mean, I feel
Love
like that
that.
helps.
That.
So anyways, though, I think that you will love that SLU because it's gonna make you feel the same way but more.
energetic. I'm going to get a little more.
Just
I
the
need to
muscle
get,
part.
I'd like to get to 8 o'clock.
Yeah. Not energy wise, but like the muscle wise.
Yeah.
That's how I feel on it. I mean, I just feel like it's ripped up. I feel like the composition of my body is better. Like I bet you if I did an in-body scan, my body fat's down.
Wow.
And I can feel it. I can see it. Like when I turn, I can see all my ribs, you know, like I just feel like it sucked me in like a little bit.
It's amazing.
Yeah.
And it's not an energy like if you drank too much coffee.
No.
An inherent energy to get through the day. I'm a jerk. I didn't reorder my supplement.
Yeah.
And so I was off SLU and methylene blue for 2 weeks. And I noticed I started hanging out in bed after dinner. I didn't go to the gym for 5 days in a row. I was starting to slip back into my old habits. And then finally I was like, whoa.
Yeah.
I've worked way too hard
Yeah.
to get to where I am now, just to allow complacency to rob me of that. So
That's why I have a buddy system. I will always come pick you girls up, right?
We do that. I feel like I'll be like, what are you doing?
Well,
You need to choose your crew. This is about Sense of Sunshine, right? The people that hold you accountable. Jill this week was like, "You're going to run on Tuesday." I was like, "Huh?" She's like, "What was it? Catch me if you not
the shipper.
Shiver. I almost died. Thanks, Jill.
So
but listen, she's like, no, you got to go. And the only time I could go was at 6:15 in the morning. We'll sign up right now because you're not going to get in. So now I'm committed 3 days earlier.
Yeah.
And then the night before, she's like, this is what you're going to run because yes, you can. And I'm like, what the?
I feel like we have to have Jill on some. Yeah.
We have this girl gang now where everybody on Saturday is like, okay, well, I'll see you at 8:15. And we're like, oh, we're going to take it easy. And then it turns into a
run as fast as you can.
On the treadmill, going at 12 or faster, hoping I'm not peeing my pants. And it just turns into this amazing. I have no shame throwing up.
You're texting that when I'm like, for the love of God, please.
Yeah, I no shame in my game.
No. And I must say, it's not competitive.
No,
like,
it's not.
Whoever wins that day could change by the day. And there's like not really winning and losing, but there is. But the person next to you is pushing you to be better. And most of the time, you're like, I would not have done that if you were next to me. Thank you for being awesome.
Yeah,
like,
so get yourself to a place that you can be held accountable with your peeps because it really does make all the difference. All the difference. And I think to go on that, we have some exciting news that one of these days, we are going to be advertising in probably the next couple days a date that we would like to go to Sense of Sunshine and
Sam.
and we would like to go live, and we want your questions. Nothing's off topic,
right?
Everything girl talk. So
it's scandalous.
It's good.
We'll probably have prosecco that day.
Yeah.
We're not.
We should do it at night because then more people
could do
about and have a drink.
Yes. And I told Lynn before you got here, what I love about this is that we are having the conversations on record that people are having at the coffee shops, in their car, on the phone, in text message. Just bringing that girlfriend chat to YouTube or wherever you're seeing this to talk about the things that people aren't talking about.
Yeah.
Yes.
The hard things. And if you don't have someone to talk about them with, we want to talk to you.
We're here.
We're here for you.
We're going through it. We're all through
there.
Everyday real problems, and let's get through it together. Get your group. And so look for in the next couple days, some dates or a date that we will put out there that we will go live. We will put it on our social media. We will put it everywhere that we can to advertise to make sure that you're in.
So you can join us and ask whatever you want.
Live question.
I love it.
So much fun. Yeah. So have a glass of Prosecco or hot chocolate or whatever with us. And we look forward to it.
All right, girls. Thanks for today. This was really fun.
It was fun.
Yeah. All right.
All right.
See you guys soon.